Okay, this video briefly discusses why blacks in Lauderdale Lakes, Florida are more vulnerable to COVID-19. So, if you Google Lauderdale Lakes, Florida, this is the location of Lauderdale Lakes in Florida. Okay, this news comes from this news article, and you can Google this news article if you want. So, if you Google Lauderdale Lakes, Florida, it's going to take you to numerous government and other legit sources online. And the total population in Lauderdale Lakes is about 32,593 people about 10 years ago. We haven't had the 2020 census yet, it's still ongoing. And Lauderdale Lakes still has a growing population. The growth is close to 3% from 2000 to 2010. And as you can see from this table, the population density in this city is quite high. And as you can see, as mentioned by the news article, Lauderdale Lakes is predominantly black. And maybe some kind of residential segregation is happening in Lauderdale Lakes, given all these demographic measures. And maybe blacks or other people, blacks especially, who live in Lauderdale Lakes, they experience some kind of social exclusion or maybe some kind of segregation and isolation. And because of their pre-existing condition like hypertension and diabetes, blacks living in Lauderdale Lakes are more prone to contracting coronavirus. So this is another portrayal of environmental justice. Due to their pre-existing conditions, blacks in Lauderdale Lakes are exposed to health risks like diabetes and hypertension, which increase their risk for contracting the virus, which makes them more susceptible to the coronavirus. Okay. This is also information from the 2010 census from Wikipedia. And they actually obtained their data from this website. So it's legit. And here are the zip codes encompassed by Lauderdale Lakes. And you can see the population density is quite high. And the city's population is estimated to grow again. So, even though growth was higher during the 80s, but population growth continues to take place over time, and the estimated growth is about 11.4% in 2018. So, if you read certain clippings, certain portions of the news article, yeah, this city has 6 confirmed cases of the virus. And maybe people living in Lauderdale Lakes, they lack access to testing. So, the authorities suspected that the number of confirmed cases are underreported. And if we compare Lauderdale Lakes with other places in Florida, maybe there are some sort of health disparities or healthcare disparities, because government at the local and state level assume that the numbers could be underreported because not everybody in Lauderdale Lakes have access to testing or know how to get tested. And from what's described in this news, it seems that people living in Lauderdale Lakes is an underprivileged group. Maybe they are not aware of how to get tested, and this implies that they cannot fully assert their rights to health or healthcare because they are unaware of their rights to health and healthcare. So, if we compare Lauderdale Lakes to other places in Florida, maybe there is some sort of socio-economic gradient in health. And maybe there's also relative deprivation being depicted here. Maybe people living in Lauderdale Lakes, they lack the means to get tested or to prevent being contracted of this disease. So, if you go to Census Quick Facts and if you do a search on Lauderdale Lakes and then you do another search on Broward County, this is the county where Lauderdale Lakes is located, and you compare the median household income, you compare the per capita income, and you compare the percentages of people living in poverty. We see maybe relative deprivation being depicted here. The median household income and the per capita income in Lauderdale Lakes City is somewhat lower than Broward County. Even though and the percentage of people living in poverty for Lauderdale Lakes City is also somewhat higher than Broward City. So, there are two kinds of poverty. One is what we call the relative poverty. You can read the definition from this website, or you can just grab any textbooks, any intro to sociology textbooks. They will explain absolute and relative poverty. If not, just Google. So, we are not sure whether people living in Lauderdale Lakes experience absolute poverty. It's not manifested in any official numbers, but it's quite certain that relative poverty is being portrayed in Lauderdale Lakes. As we can see from the median household income, from the per capita income, the income in Lauderdale Lakes, either by person or by household, they are both somewhat lower than the income for Broward County, and the percentages of population living in poverty for Lauderdale Lakes is somewhat higher than Broward County. So we see relative poverty and relative deprivation being depicted here. Oftentimes, our cultural and social capital determines our life outcomes, be it our education attainment, our occupation attainment, our wealth accumulation, and our health outcomes. So, what is cultural capital? Cultural capital is the know-how. It encompasses our taste for wine, music, and movie. Cultural capital can also be our intellect, how we dress, how we talk, how we mingle with others, our mannerism. Cultural capital determines how cultured we are or how culturally competent we are. And what is social capital? Social capital pertains to our social network, who we mingle with on a daily basis, who we know. We often interact with those who are like us in terms of cultural capital or in terms of our belief system and value system. We also interact with those who have similar social backgrounds with us. In other words, we also interact with those who share the same social backgrounds or who happens to fall in the same social class as us, because guess what? We live in the same neighborhood. So we see them day in, day out, and it's a no-brainer. We mingle with people who are like us more. I'm sure you heard of the words or the phrase that says birds of the same feather flocks together. So, how to increase access to COVID-19 testing for blacks or for other people living in Lauderdale Lakes? Should we have something like a culturally adapted screening, diagnosis and treatment? Should we promote this diagnosis or screening or treatment in a language or in terminologies these people can understand or relate to, so that they are more inclined to get tested and they know where to get tested, so that they can be diagnosed and be treated if necessary? And should government in Florida cooperate or collaborate with other entities like medical associations, community groups, other NGOs, or even the private sector to ensure successful and sustainable implementation of these testing and prevention strategies?